everyone. Today we have Dr. Nathalie Lédée, who is a pioneer of reproductive immunology, and she specializes in recurrent pregnancy loss. Let's understand concepts about recurrent pregnancy loss regarding investigation and treatment from her. Dr. Lédée, welcome to India, and I just want you to tell our patients what is recurrent pregnancy loss.
So the recurrent pregnancy loss is when you are pregnant, but you will have a miscarriage in the first trimester. And we would say it's recurrent pregnancy loss if you have 2 consecutive pregnancy loss before 4 months of pregnancy.
So, recurrent pregnancy loss is a devastating condition both for the patient and clinician. But when do you think patients have to approach a doctor regarding recurrent pregnancy loss? Do you think they have to wait for 3 abortions, 4 abortions, or is it wise enough for them to approach the doctor even after 2 abortions?
So the recommendations are clearly now to begin the exploration after 2 miscarriage. And then we will have to have a multidisciplinary approach to understand the mechanism of the miscarriage, and then we will be able to treat.
That's a very important point, Dr. Lédée, because you spoke about multidisciplinary approach. So what do you mean by multidisciplinary approach?
Multidisciplinary because on the gynecologic level we will have to explore the uterus, the ovarian reserve, and we will have also to have an idea of the endocrinology level, but also our work, the coagulation, our work from the genetic part to have the karyotype, to do the autoimmune assessment to see if there is autoantibodies. So there is multidisciplinary things to check to have the diagnosis of the causes.
So just for the information of our patients, I have to tell you that we have a multidisciplinary clinic in our center where we have immunologists who will work on immune aspects of pregnancy loss, we have endocrinologists, we have geneticists, we have neuroandrologists who also investigates about the male factors for recurrent pregnancy loss, we have the embryologists, we have infertility specialists, we also have the endocrines I told you, and the counselors and the doctors from high-risk pregnancy. So 7 to 8 of us will sit together, discuss what could be the problem, because many times it could be falling on the blind spot of my diagnosis. I may not be concentrating more on immune part because I am not a specialist in that. So probably it should be multidisciplinary and it has to be approached from multiple directions, and that's a
definitely.
Yeah. So and then Dr. Lédée, you please tell us about what are the most common investigations that any couple has to do when they come for recurrent pregnancy loss evaluation, because many times people do think the recurrent pregnancy loss is a woman's problem. Basically it is a problem with the woman or it is with her uterus. People forget that the man can be equally contributing for the pregnancy losses. So could you please briefly tell us what investigations that we have to do in a case of recurrent pregnancy loss?
So on the female side, we will have to do an hysteroscopy to be sure that the anatomy of the uterus is correct. We will have to evaluate the ovarian reserve, the coagulation. On the main part, we will have to check the fragmentation of the sperm, and for the couple we will have to check the karyotype of both the male and the female.
Yeah, that's a very important point where couple karyotyping you mentioned, which means we have to do the blood workup, especially the karyotype of both husband and wife, which is a very important investigation for us. And most of the times if the pregnancy loss is happening, what do you think the most common cause could be?
The most common is genetics. It means the embryo is abnormal and it occurs in humans very frequently. So it's the most common approach. But usually we say more miscarriage we have, less the explanation is genetic. Then we will have to go on the immune side to have some other exploration.
Yeah. So we have to understand, this is for our viewers, where human reproduction is the most inefficient process, and it is not just every pregnancy which is conceived will see the light of the day. Most of them do abort, but when it is recurrent is what we have to check where is the problem. And as I told, it is definitely multidisciplinary, and the most common thing is to evaluate the embryo, or at least the embryos are formed from the gametes, at least we have to evaluate the parents. So couple karyotyping is very important, followed by, as Dr. Lédée said, it is evaluation of the uterus, investigating the hormones, basically it could be thyroid hormones, and also to look at the ovarian reserve of women. Lesser the reserve, more probability is of having an abnormal embryo. It is equally important to evaluate a man, especially to look at the semen parameters and if there is any higher fragmentation in the sperms. And also the last but not the least is the immune profile. That is basically most common thing is antiphospholipid antibody syndrome. And as Ledee said, and I am reiterating, most of the times when it is recurrent, we may not find any cause. And that is when it becomes very frustrating for both patients and doctors. But Dr. Lédée, we have seen so many prescriptions from patients where even if it is one pregnancy loss, they will be on so many multiple medications. I have seen prescriptions with 30, 20 prescriptions wherein they will be taking heparin, that is daily injections, and multiple progesterone injections, and also progesterone tablets. Most of them will also be on steroids and intralipids, IVs, whatnot. So do you think this is scientific, just to put them on empirical therapy, or do we have to be targeted in our approach?
Definitely we need to be targeted. If we just put all the therapy together, it will be worse, because the therapy could be deleterious if you mix some principles that are antagonists. So really the basic is to understand the immune mechanism and then to define the therapy, but not adding by hazard the therapy. It's always useless.
Yeah. And then also regarding the cost, when we put them on empirical therapies which we don't know whether it is going to be beneficial or not, the cost of the treatment is also going to go high. What do you think about that?
I think really the structural point is we need to understand the cause, and then we will define the therapy. It's why empirical prescription, perhaps it will work, but most of the time it will not, and because it's ineffective.
Absolutely right. And then I want you also to clear the misconception. If a couple is having recurrent pregnancy loss, they think IVF is an answer. Do you think it is right?
No, it's the contrary. In fact, it has been very well demonstrated that those women are fertile, they are able to produce an embryo, the embryo is able to implant. So it's really the time of the placentation. When we do the IVF, we go until implantation, but we do not go further, so it's useless, and it has been demonstrated that it's deleterious. It decreases the rate of live birth, the stimulation. So clearly it's not
so IVF is not an indication.
No, it's
if
not.
It is recurrent pregnancy loss. Yeah. And one more thing, most of our patients, they do ask us, doctor, why don't we just go through surrogacy? Do you think surrogacy is an answer for recurrent pregnancy loss?
It could be if you're not able to find the causes, if the uterus is destroyed, there is no other solution. But before going to surrogacy, you need to explore and to try to find solutions. Clearly, we need to have the multidisciplinary approach to find the diagnosis. This is the key.
Yes, and also for the benefit of our viewers, we have to understand surrogacy is not as simple as you think. There are legal, it should be done within the legal framework, and the legal framework also emphasizes that there should be an indication. So just because it is pregnancy loss does not mean surrogacy will be an option. Even if the problem is not identified and we transfer the embryos into a surrogate, even she can land up in an abortion, is what I want to emphasize to our viewers. And most importantly, I know it is emotionally taxing, and people go through a lot of emotional roller coaster when they hear the news of pregnancy, but it is a loss, and then again a pregnancy and then a loss. So many times they actually get